The 8th IAS Conference on Pathogenesis, Prevention and Treatment, known as IAS 2015, will be held in 2015 in Vancouver, British Columbia, Canada. As International Chair of this conference, I hope to see you there. It will take place at a time of notable scientific progress in the field and a resurgent optimism around talking about the beginning of the end of AIDS. Recent conferences organized by the International AIDS Society have shown that early treatments could effectively stop HIV transmission, and since then, treatment as prevention has become a vital tool in reducing HIV. Also, in the last several years, a number of groundbreaking studies in HIV science have demonstrated their potential to change the course of the epidemic and have led to renewed momentum for an HIV cure. IAS 2015 will be a unique opportunity for all those involved in the global response to HIV, including scientists, clinicians, public health experts, community leaders, to meet and examine the latest scientific developments in HIV-related research. Importantly, the IAS Conference is a forum for exploring how scientific advances can be translated quickly into effective interventions to prevent and treat HIV, particularly in low and middle income countries. At IAS 2015, we will develop strategic discussions around the increasing challenges of comorbidities, including tuberculosis, hepatitis, and diabetes, and the collaboration across various medical disciplines. We're excited that IAS 2015 will be held in Vancouver, Canada, which has a long history of leadership in HIV and AIDS, particularly in the implementation of prevention strategies, people who use drugs and others, and in research surrounding antiretroviral therapy. We're very much looking forward to seeing you in Vancouver. In the months ahead, we encourage you to learn more about the IAS 2015 scientific program and to get involved in this landmark event by developing and submitting abstracts. See you in 2015.
It is a great pleasure to co-chair IAS 2015 with my good friend and collaborator, Dr. Beyrer. Together, we are working hard to create a strong scientific program. While there is no cure or preventive vaccine for HIV and AIDS, science has made remarkable advances in both of these areas, and we expect further new data will be presented at the 2015 conference. HIV treatment and care have evolved markedly since the coming of age of highly active antiretroviral therapy at the IAS Conference held in Vancouver in 1996. Newer, simpler, safer, and better regimens have transformed HIV infection into a truly manageable condition. As we approach the deadline for the 2015 MDGs, we look forward to re-evaluating the AIDS targets over the next year with the leadership of the United Nations AIDS Program. New, bold, and ambitious targets will be needed to fully deliver on the promise of treatment as prevention to end AIDS during our lifetime. Our own experience in British Columbia demonstrates that treatment as prevention can virtually end AIDS and dramatically decrease HIV transmission. Over the last 2 decades, the expanded rollout of HART in BC has led to a 95% decrease in morbidity and mortality, and a 2/3 decrease in new HIV infections. In particular, we have virtually eliminated vertical HIV transmission and new HIV infections among people who use drugs. The latter has been particularly successful as a result of the very progressive harm reduction policies embraced by the provincial government. I look forward to welcoming you to our beautiful Vancouver city at the IAS 2015. Nearly 2 decades after the historic Vancouver 1996 conference, I hope that 2015 will go down in history as the point in time when we fully realize that together we can stop HIV and AIDS.